The 12th season of Consider This is brought to you in part by From the Top, a national program showcasing the musical talents of young people. From the Top can be heard on KVNO Classical 90.7 each Saturday at 6 p.m.
Consider This, a program of issues and information behind today's news. Once again, from the campus of the University of Nebraska at Omaha, here is your host, Kathy Wyatt.
What do President Obama and the students at UNMC have in common? Hi everyone, I'm Kathy Wyatt. Welcome to this week's edition of Consider This. The answer, they share a vision of creating stronger, healthier communities. One way to do that, something called student-run clinics. And here to talk with us more about it today are Natalie Stavas, a second-year medical student at UNMC, Dr. Audrey Pahlman, Clinical Associate Professor of Family Medicine at UNMC's College of Medicine, and Dr. John Benson, Professor of Internal Medicine at UNMC's College of Medicine. Thank you all so much for joining us, and welcome to the program. Natalie, let's start with you.
Okay.
Paint a picture of a student-run clinic for us.
All right, well, a student-run clinic is a place where we as students provide high-quality health care for patients who otherwise would not receive any health care. We provide health care to underserved populations of Omaha, Nebraska, as well as surrounding areas. We are a interprofessional student-run clinic, which means students from multiple disciplines come together, like medicine, nursing, physical therapy, pharmacy. We all come and we work together to create a healthcare home for patients who have nowhere else to go. It's a place where they can come and receive all the health care they need. We can give them medications, we can do physical therapy with them, we can do general doctor visits with them, and we can also give them education. We do a lot of primary prevention, we do a lot of health maintenance with these people, so we really enjoy as students working at these student-run clinics and really giving them the health care that they need and deserve.
Okay. Dr. Pahlman, what a great opportunity for these students as well as a benefit for the community. How did all of this evolve?
About 10, 12 years ago, a couple students came together and they talked to Dr. Metter and my husband and said that they had heard about student-run clinics. They'd be interested in doing a student-run clinic in Omaha. And so it got started. We partnered with the University of Nebraska Med Center. And so UNMC Physicians actually is our home, or the clinic that we work in. And while the students run the clinic, the faculty keep it running. And by that I mean every year we get a new student board. They're responsible for fundraising, they're responsible for quality measures, they're responsible for patient scheduling. They get interpreters for people who don't speak English. They provide medications, they pay for medications. Certainly the number of patients that they can take care of is not a large number of patients, but they have a very significant impact on those patients. And so Natalie is finishing up this year. She's at the end of her year. She's been one of the co-presidents. And so she has all of her medical studies that she's supposed to do, and then she volunteers to do the sharing clinic president. And so part of what she does as president is make herself available for interviews like this. And then they select their new board, and so they have just introduced us to the new board that the faculty will be working with. And we just met the board. I think we meet the new board the 1st of April. They will take over, and so it'll be another group of students. The students are all volunteers. They don't get any additional credit for it. They don't get residencies that they want because they volunteer for the clinic. They don't get a better grade in any of the courses. They just do it because they have a love to serve the underserved.
Okay, and you mentioned something in there about something very important, funding. Obviously a program like this one would not be successful without, of course, the students who are doing what they're doing, but the money to back the idea. Do you find it difficult to raise the necessary funds year after year?
No, we have students on the student board raise the money, and we have, obviously we can't take care of all of Omaha, but we take care of the population that we take care of. We have 2 students that were responsible for funding. So organizations have been very, very good to us. Our students go out and make a formal presentation or formal ask, just like other organizations do, just like Campfire has to raise money, the sharing students have to raise money. The faculty give of their time to staff so that every patient is actually seen by a licensed provider. Most of the money that they raise goes to provide some relief for prescription costs for the patients, because we know that with chronic disease that you have to have medications for it. The Nebraska Medical Center provides limited x-rays and limited laboratory for the students at no charge, and so they've been very helpful. The NU Foundation's been very helpful. We have community-wide partnerships that help us every year with funding. But every year we get 2 new students, and their job is to look at the budget, determine what you can fund, what you can't fund, and go out and raise those funds.
Amazing. Dr. Benson, from where you sit, what do you see as the biggest benefits for what these ladies are talking about?
Well, it's a benefit both for medical education and for the community. I'm particularly interested in its interprofessional experience. As Natalie pointed out, these young medical students are working with students in nursing, pharmacy, in physical therapy, and other professions, which is what they'll be doing in their careers more than ever. So that has great educational value. For the community, it's access, access, access. And the sooner you can get to disease and treat it, the cheaper it is to treat, the greater health there is for the population being served, and the greater their productivity in the community. So access is the great benefit for community.
Wonderful, thank you. And Natalie, you have 3 such clinics right now, and what we want to do is we have a graphic that identifies those 3, and they all have a name, and so what I'd like you to do is just tell us what the 3 are and then walk us through each one of them.
Okay, great. Well, our first clinic is actually called the Sharing Clinic. The Sharing Clinics are actually a group of 3, but one of them is named Sharing. I know it's a little confusing, but this clinic sees chronic patients, and by chronic patients I mean patients with long-term diseases such as diabetes, hypertension, high triglycerides, and other diseases that they may have, and we treat them on a regular basis. They come once a month, twice a month, sometimes every few months, and we provide their medication for them, and we do teaching and counseling for them too, with the hope of actually improving their health and improving their disease, and maybe getting them back out into the workforce and able to take good care of themselves. The Sharing Clinic also sees pediatric patients. We started in 2008, September of 2008, seeing kids. We do see kids from Liberty Elementary School currently. We are actually trying, one of our goals is to expand our pediatric population and start seeing more kids. These are all kids that don't have any insurance. We also take acute care patients, meaning people who are feeling sick that day, and even if they don't have an appointment, they can walk in and be seen. We see an average of 15 to 20 patients a night there, depending on the weather and how cold it is. And we do charge a $10 copay. If the patient cannot pay, they are never turned away. We feel very strongly in empowering the patient, and research has shown that one way you can do that is by giving the patient a little bit of control and investment in their own health care. And if they feel invested in their health care, then they are more likely to take the initiative to work with you and to change things that need to be changed. Okay. So we do a $10 copay, but like I said, we're never turn a patient away, especially with the economy these days. Times are tough for a lot of people. The Good Life Clinic, that's more in a little bit north of the Sharing Clinic. That sees type 2 diabetic patients, and type 2 diabetic patients only, and it's kind of the same concept of the Sharing Clinic in the fact that it's multidisciplinary. A lot of students come there to volunteer. We have medical family therapy that comes and does counseling with the patients. We have dietetics that come and go through the food pyramid with the patients and what a healthy diet really is. And then we have the medical students as well, and the physical therapy students. And that clinic is open the 3rd Wednesday of every month. And then our last clinic that we have is the Respect Clinic. Now, a national statistic about Omaha, which isn't that great, is that we have one of the highest rates of STDs in the country for certain STDs. So students took the initiative to open a clinic that we call Respect to treat and give prevention on STDs. So at that clinic, patients can come. You can have insurance. It's completely anonymous. Anyone can walk through those doors on Wednesday nights, and they can get screening, treatment, and education. So we find that to be a very important need in the Omaha community.
Dr. Pahlman, just sitting and listening to Natalie describe all of this and be as enthused about it and compassionate about it and passionate and all the rest.
Yes.
I just, what goes through your head when you see a student this involved in what's going on and this excited about the future of
These are the students that are probably going to build hospitals in the future. These are the students that are going to lead mission trips. These are the students that get it and are going to be able to put it together. And they just sort of bubble up through the system and involve themselves in the sharing clinic. And periodically we get a new faculty board member, and right before I came today I was talking to our newest faculty board member, and she said, I go to these meetings and I just can't believe what the students do. We also have got PA students and nurse practitioner students that are involved in the clinics. And then there's a couple other things that they do on the side. We have the College of Dentistry is involved out of Lincoln, and they do some outreach programs. It's not an interdisciplinary model, but it certainly is a service learning project. And then the sharing students in the sharing group, they go and they do physicals for some of the junior highs that the kids can't afford sports physicals, or they can't afford their 7th grade physicals, and so they organize those events. We do a little bit of work with Educare because the bottom line is we do influenza vaccines, because if a mom is working and she is marginal in terms of job security or in terms of income, if she gets influenza, or if her kids get influenza and can't go to daycare or can't go to the facility for a few days, then pretty much the game's over for them. And so we really try to work with the organizations or the community to put our part into this.
And Dr. Benson, my gosh, certainly an idea worth sharing with just anyone who will listen. And I understand that there is a conference that is coming up so that we will be giving the students at UNMC an opportunity to pass along to other students what they've learned and get them all excited about it. So ultimately, everyone will benefit. Can you talk to us a little bit about this conference?
Well, it's this weekend, and there are over 250 students from over 40 other medical schools coming to Omaha to join in this celebration. And its impact, therefore, goes far beyond the city of Omaha or an area of Omaha, and has, for medical education, a very strong kind of incentive, which I like to call, I pick up on your word, passionate professionalism. We like to think professionals put patient welfare ahead of personal reward. And what better way to cultivate a sort of spirit of service than to have this volunteering going on in young medical students, actually before they get immersed in the more inpatient, high-tech, very severe chronic disease education that they get in the second and the third and fourth years. So the impact goes well beyond Omaha, and it fulfills this wonderful idea that we're all professionals and that we work together, as I indicated earlier.
Okay. Natalie, talk to us about the type of planning that has gone into something, because I understand the numbers are growing, and
Yes.
People are not only coming from the U.S., but now they're
Right.
coming from outside of that. So tell us a little bit about the behind the scenes with all this.
When we first started thinking about this conference, we started because we realized what a great impact that the Sharing Clinic has on the Omaha community. We've seen more than 6,000 patients since opening in 1997, and we have about 1,400 patient visits a year. So we got this idea, what if every school in the country had a student-run clinic, like the Sharing Clinic? The impact would be unparalleled. I mean, we could answer this, we could help address the healthcare crisis with all the people that are uninsured or have just lost their job and lost their insurance through no fault of their own. And so we wanted to help inspire schools, initially locally and regionally, to maybe think about how they could incorporate a student-run clinic into their school. We thought we have a great model. It might not be the perfect model or the best model out there, but it's a good one. And we wanted to share. Well, it kind of took off like wildfire, and everyone was very, very interested. And we have, like Dr. Benson said, over 40 schools now from across the country coming. We have 2 schools from Canada coming, and we actually have people from Australia coming. Australia has no student-run clinic sort of infrastructure in their medical systems, so they're coming also to learn. Students are a valuable force. I think we're a huge resource that can be used, and if we could just mobilize students across the country to realize that they can make a huge difference. I mean, we're not just stuck in the library. You know, we don't just go to class. We have the resources and the knowledge to help these people, especially when no one else will. So we do have 250 people coming. We hope to, we've been doing a lot of planning. It's very similar to a wedding, I must say. I'm planning a wedding right now, so strikingly similar to wedding planning. But it's well worth it. It's definitely been a great experience for us, and especially if we can just help more schools understand how wonderful it is for both the students and the people we're helping to really make a more impact, a bigger impact in this nation.
Well, and Dr. Pohlman, you know, something like this, people come together for these conferences and they get so psyched about what's going on, and then they go their separate ways. And so how are you going to help the students, and how are you all going to work collaboratively to ensure that there is the necessary follow-up with these folks who are going to be coming?
I'll answer part of that, and then I'm going to pitch part of that to Natalie's way.
Okay.
So when the students came and said we would like to have, as faculty advisors, what we do is we try to implement what the students dream of, help them implement what they dream. So they came and they said we would like to do a conference, and it's like, well, we need to make it a little bit different. And so why don't we make it a student-run conference? Because I don't think anybody has done a student-run conference about student-run clinics. You know, they've had conferences that faculty members who are interested in getting promotion and tenure have done things, but we haven't really had the fresh student involvement. And so why don't we do a student-run conference about student-run clinics? Like, that worked. So I was working to sort of anchor and frame the students at the beginning, and I said, okay, now when you do this, how many people do you expect? And one of Tyler on the planning committee said, well, you know, you need to go big or go home. As a faculty member, you don't want them to fail. I said, if you get 10 or 15 people to come, and people from UNMC, I think that would be just wonderful. And so they put it out on the listserv, and because it is interdisciplinary and because there is such limited opportunity for people to hook on to this initiative from an interdisciplinary standpoint, from the nursing, from the physical therapy, from the pharmacy, from the School of Allied Health, we have med tech, we have PA, because there's such limited ability to hook on to that. I think that's the reason why we obviously hit this untapped need. Because we certainly never envisioned that this many universities would let this many students miss school for a day so that they could do the Friday travel day, so that they could be at the conference in Omaha on Friday, Saturday, and Sunday. So we're thrilled that, I mean, this is a big deal. How do we keep it running after this? I think Natalie may, I don't know.
Well, we actually are launching a brand new society at this conference. It's the first of its kind, and a little history behind that is there's no literature out there on how many student-run clinics exist and the impact they have. If you do a literature research on it, I tried to do one and I couldn't find anything. And I was like, well, this is unacceptable. We need to create a database for students to have a resource. So we decided to launch a Society for Student-Run Clinics. we have created a website and gathered data and sent out surveys to all the schools across the country. And we will be launching this national website at our conference. And it'll be a platform basically from which all students across the country can have a resource for, we're having 25 tips how to start a clinic, we're having a blog on it, we're having a whole bunch of different links for students to go to, faculty support, student support. And I think really because we're starting this new society, from here on out, students will have more information on student-run clinics and a better idea of how many exist. And then we'll actually have tangible data for the impact we truly make across the country on people who don't have any insurance or are underinsured.
Right, okay. Dr. Benson, just sitting here listening to all this, you just have to be thrilled. And I do need to make a point that the students are really as good as the leadership that is demonstrated. So, you know, hats off to the two of you for helping steer them in the direction. That obviously doesn't happen all by itself. So, Dr. Benson, when we're looking at the bigger picture, especially when we talk healthcare reform, I mean, this is a big deal. What kind of, talk to us a little bit about both the short-term and the long-term future in regards to having these as part of what it is that we're doing now.
Well, today we rely, in my view, too much on contributions like student clinics, and there are other clinics and communities pretty much handled by medical schools around the country, but they're not student-generated, as is the Sharing Group. And the new society, I think, will make a big difference in that regard. It seems to us that everybody should be insured, and that reform should guarantee that in some way or another, so that we wouldn't have, in a sense, the need for this. I think there'll still be the phenomenon of this. Students like to contribute. Students learn from this. The community's better for it. The whole university enterprise is better for it. And so if we can translate this into a national phenomenon, I think it's very, very useful. Now, would it be supplanted by, let us say, a new national program for healthcare reform? I rather doubt it, because it's maybe complementary to what would be a national project where everybody got insured. But a lot of people are unable to avail themselves of the insurance that they may, in fact, be entitled to. And to be able to come to a clinic like this, where they're treated well, where there's some continuity of care, encourages them to get health care sooner and more effectively. I think that healthcare reform is a social as well as an economic enterprise. And here we see in spades a very wonderful social answer to this.
Okay, very good. From a physician perspective, Dr. Pahlman, is this generally accepted across the board by your peers and so forth to have the students this involved? Do you have anybody out there who's saying, I'm not sure of this direction? Any negative feedback at all?
There are virtually no naysayers. The questions that I get are, how are the students supervised? Is this safe for the patient? And the answer is there are faculty that staff these clinics that go in and see every single patient that is seen. And so there's a faculty provider that goes, whether it's a PA provider or nurse practitioner provider or physician provider. The mental health therapists that work at the Respect Clinic, because diabetes and depression run so well together, they're staffed by one of our licensed mental health therapists. So some naysayers about, well, you know, students, but there's so many safeguards in place to make sure that they are appropriately staffed, that the care is as good. The Diabetes Center, for example, has an endocrinologist who comes up and staffs on a regular basis and sees the patients. And those patients are getting absolutely excellent care by people who wrote the book about how to manage diabetes. Figuratively and literally wrote the book. So the main question that I get as a faculty advisor is, how do we get involved? If we're from the College of Nursing, how do we get nursing students involved? How do we get on board?
Okay. And Natalie, how is it that you are able to get the word out to folks that these places exist? Because I'm sure that there are individuals watching thinking, oh my gosh, I had absolutely no idea. Now you talked about a little earlier about being limited in some ways, but if there are people out there who have this need, talk us through briefly the steps that they would take to inquire.
Well, one of the goals that our board of 2008 decided to do was increase awareness about these sharing clinics. And so we have taken steps this year through programs like this and through contacting newspapers and kind of getting the Nebraska Medical Center PR involved so that people are aware. It's raising awareness that we are there for them and that the students care and are there to help them. So this year really is the first year that we really have gone out and tried to say, let's raise awareness in the community, and how can we best do that? We are currently still working on that. People who do need health care are encouraged to call the sharing clinic. The number is in the phone book, the number to the clinic. And if they call the sharing clinic and ask about potentially getting health care there, then we would be able to direct them to the right person to talk to.
Okay, and at the end of the day, obviously you're putting a lot of work into this. Just in 15 seconds, what's the biggest reward for you out of all this?
The biggest reward for me, it's got to be the patients. I have a patient that I've been working with for a little while, and to see them improve and to see them feel better and to see them get back out into the community and be able to work and be able to take care of their children, that's got to be the biggest reward.
Okay. Thank you so much. And as we always do, we have a website we want to put up for folks in the event that they need more information. And that website is www.unmc.edu/sharing. Thank you all so much for joining us.
Thank you
we
very
appreciate
much.
it. Thanks
Thank
to you
you
for watching. We will see you next week.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at unotv.unomaha.edu. If you'd like to share your comments about this show, call UNO TV at 402-554-2516 during regular business hours.
The 12th season of Consider This is brought to you in part by From the Top, a national program showcasing the musical talents of young people. From the Top can be heard on KVNO Classical 90.7 each Saturday at 6 p.m.